I feel like anxiety has become kind of a bad word, as if it's this horrible thing and you kind of always need to treat it. But actually, anxiety can be super protective. We should all have a little bit of anxiety. If we didn't, we probably wouldn't be very safe, right? So, first of all, how is anxiety different from fear? So, fear is when there is an immediate or perceived immediate threat. So, there's a bear and I see the bear. Anxiety is more so the anticipatory worry about a potential danger. So I worry that I will see a bear. And if we didn't have anxiety, we might not be super productive, right? We probably wouldn't study for tests. We wouldn't prepare for work. We wouldn't, plan for hurricanes and things like that. So it's really important to have some level of anxiety. And so it's not necessarily a bad thing. It's only when it gets to the point where it is disruptive to your daily routine or it causes significant distress to where it impacts kind of quality of life, or it kind of gets in the way of you doing the things that you need to do or want to do. That's kind of when we want to address anxiety concerns. And for some people, especially for our younger patients, anxiety isn't necessarily even the cognitive symptoms, right? It's not necessarily even the worry and the thoughts about what could go wrong or something bad happening. It can often just be physical or somatic symptoms. So if your kid complains about frequent headaches before school or tummy aches before socializing, those are some signs to kind of dig a little bit deeper and see if there might be some underlying anxiety, or if you're, the heart rate goes really fast, or they get really dizzy, or they get out of breath. Those are all things to keep an eye out because, again, anxiety can look very different in our younger children. And so that can kind of help you determine if it's getting to a point where it's overwhelming for them to manage. And then I'll chat more about treatment in the next video.